Hi students, good evening. Welcome to one more Why Conundrum. We'll be starting to discuss with the famous question, why heparin behaves as a coagulant agent. Okay, so in this question, usually as we know, heparin is not a coagulant agent, heparin is an anticoagulant drug. But why do we call heparin as a coagulant agent? We'll be discussing that one by one. Now, first of all, heparin, as we know, is an anticoagulant drug. So no doubts at all, heparin is an anticoagulant. But it carries an important risk of adverse effect. Before that, how is it behaving as an anticoagulant? This anticoagulancy is primarily because of its mechanism of stimulating the antithrombin molecules. Previously, it was named as antithrombin 3. The current nomenclature is antithrombin. As the name itself implies, antithrombin means this is going to be breaking down. This in turn will be breaking down factor 2A and factor 10A. Both of these molecules will be broken down by the antithrombin. It is a physiological molecule. That physiological molecule is going to get stimulated or activated by your heparin. That's how heparin is behaving as an anticoagulant drug. Okay. Now, what are the adverse effects? What are the adverse effects of heparin? I'm going to be explaining that with the mnemonic, guys. The mnemonic goes batao. Batao is the mnemonic. B stands for bleeding. Patients will develop bleeding. The T stands for thrombocytopenia. This is what we were trying to explain about right now. H is for patients might develop hyperkalemia. The potassium levels tend to rise up. A is for alopecia. There would be hair loss, not intense like this. There might be a milder hair loss, like it is named as transient alopecia. And O stands for osteoporosis. This osteoporosis is primarily seen in pregnant individuals, right? Okay. Now we'll be discussing about how this thrombocytopenia is actually getting developed. Okay. The thrombocytopenia is nothing but, see, consider here is where your platelets are. Okay. We have platelets, and from the platelets, there will be release of certain substances. One of the substances is named as PF4 molecules, right? This PF4 molecules is primarily be released from the platelets. Heparin, whenever a patient is administered heparin, this behaves as an incomplete antigen. It is not a complete antigen, it is an incomplete antigen. What is the meaning of it? This itself cannot stimulate the production of antibodies. That's why it is called as incomplete antigen. So this heparin has to fuse with one more substance so that it can get converted to a complete antigen. And the molecule with which it is getting fused up is PF4 molecules, platelet factor type 4 molecules. So once this molecule has been forming a complex of heparin and PF4 molecules, this behaves as a complete antigen. This itself will behave as a complete antigen. Okay. So what happens against this molecule, as we have drawn against this heparin PF4 complex, there will be production of antibodies. The antibodies like IgG antibodies is going to be synthesized. This IgG antibodies will be targeting these molecules. So what happens, there will be production of a triplet, a combination of IgG, heparin, bridged by PF4 molecules. Are you there with me? So IgG, PF4, heparin. This combination is the one which is going to be triggering. This itself will induce more amount of platelet accumulation from happening. This itself will stimulate platelet activation and platelet accumulation. So platelet factor 4 is a molecule which is going to be stimulating the platelet to get activated. So normally whenever the antibody is getting synthesized, that will further exaggerate the response, leading on to more chances of platelet to get activated and accumulated. Because of this increased accumulation of platelets, there will be thrombosis. So this is a primary concept of how thrombosis is getting developed. Okay. Now consider we have this blood vessel here. Consider we have the blood vessel. And inside the blood vessel, we have lots of platelets. For example, I'm drawing 1, 2, 3, 4 platelets I'm drawing. Totally, there are 4 platelets present inside the blood vessel. Now what happens is whenever there is stimulation or presence of this IgG, PF4, platelet factor 4 and heparin complex, this itself will induce platelet activation leading on to platelet accumulation. So now what happens, instead of these 4 molecules, what happens, 3 molecules will be joining together, whereas only 1 molecule is going to be free because the platelets are getting accumulated. Now this itself will be inducing a clot formation. That is the concept of how thrombosis is getting developed. That is how thrombosis is getting developed inside the blood vessel. Okay. Now what happens is because of this thrombosis, more of the platelets are involved in the thrombosis development. When you take up a blood sample, inside the blood sample, we can actually see decreased number of platelets. Why? Because we are calculating only this molecule of platelet. We are not calculating the other platelets which are involved in the thrombosis formation. So simply, when you look into it clinically, you start a patient on heparin. After like 5 days of therapy, as we can see, we take up a blood sample, the platelet count will start falling down. This platelet count is falling down, which means that is named as thrombocytopenia. And why is this thrombocytopenia developed? Because of the thrombosis which is developed. So this is not just thrombocytopenia, this is actually thrombotic thrombocytopenia. This is the meaning or pathophysiology of how thrombotic thrombocytopenia is getting developed. Is that clear? So simply consider we have around 1 lakh of platelets or 2 lakh platelets are there, out of which around 1 lakh and 50 is going to get involved in the thrombosis formation. The blood platelet count will be falling down below 50K or below 60K. You will diagnose the patient as thrombocytopenia. This thrombocytopenia is named as thrombotic thrombocytopenia. That's the reason why we call heparin. That's the reason why we call heparin behaves as a coagulant agent. Not immediately, guys. It will behave as a coagulant agent at around 5 to 7 days of therapy. It takes at least 5 to 7 days of therapy to start seeing the thrombotic thrombocytopenia associated with heparin. Good. Well, this is the take-home point of today's why conundrum, guys. We'll meet up with one more why conundrum as much early as possible. Good night.